Hi, I am Dr. Indranil Ghosh. I am a consultant medical oncologist at Apollo Clinicals Hospitals, Kolkata. I treat the cancer patients and try to help them through their treatment and discuss the issues about prevention, how to prevent cancer. Now, today we are going to discuss a bit about breast cancer. Now, everybody has heard, among us have heard about breast cancer, but we have many questions to ask. What is the disease? How is it diagnosed and how is it treated? So cancer in any part of the body is because of normal cells in the body which are not under control of the body and start proliferating by themselves. So they grow at their own pace without any effect from the any control of the body, and they can the cells can spread to other parts of the body and cause lot of problems and even can lead to death if it is not treated at the right time. This cannot be confused with the term benign tumor, because all tumors are not cancer. Some tumors are they are also proliferation of cells, but they can be controlled by the body and they usually do not cause much problem. But cancer cells are not under control of the body, and a cancerous tumor can spread to any part of the body. So how do we diagnose breast cancer? First of all, the symptoms and signs. Symptoms are what the patient can feel. If the patient can feel any lump in the breast, any change in the nipple, any dimple in the skin or in the nipple, any lump or any swelling in the armpit, any swelling in the neck, or any skin changes over the breast, these are common symptoms which can herald the diagnosis of breast cancer. So if there is any such feature, the patient should come to the doctor and get herself examined. Now, breast cancer is mainly a disease of the females. Even males can have breast cancer at a ratio of 100 or more is to 1. So if 100 or 150 females have breast cancer, one male can also have breast cancer. So male individuals should also think about breast cancer and learn about breast cancer. Now, when a patient comes to the clinic with this kind of symptoms, any lump or skin changes in the breast and nipple changes, then the doctor examines the breasts and the doctor tries to find out what kind of lump it is. It is a hard lump, soft lump, what type of glands are there, is there any abnormality in the skin which can make the doctor suspicious that there is breast cancer. So if the doctor suspects breast cancer, so the next step is how to confirm the diagnosis, because only suspicion we cannot treat the patient, so we have to diagnose the disease appropriately. For this, usually two kinds of tests are very important. One is getting an image of the breast. This is usually done by X-ray or ultrasonography. If we do X-ray, that is known as mammography, where a specialized X-ray of both the breasts are done, and another form is by ultrasonography. By ultrasonography also, we can check the breast and the armpits and find if there is any swelling or if there is any glands in the armpit. Now, if the mammography or X-ray are suggestive of a tumor or malignant tumor, then we have to confirm that it is indeed a malignant tumor and not a benign one, because treatment differs. So how do we confirm that? We confirm that by doing a fine needle aspiration from the tumor or a needle biopsy. We try to collect some cells or tissue from the tumor and put it under the microscope. This is usually a very safe procedure. Many patients ask if the disease can spread by a fine needle aspiration, which is known as FNAC or biopsy, but it is a myth. It does not spread like that. This is necessary to diagnose the disease, because if we cannot diagnose, we cannot treat the patient. So this FNAC or biopsy can confirm the diagnosis, and if it is indeed a malignant tumor, then also nothing to worry. Then we have to treat the patient at the right time. That is which matters the most. So suppose the new patient has been diagnosed with breast cancer. Then the next question comes to the patient's mind is what to do next, any further tests required, and what will be the treatment. Now, some tests will be required after the diagnosis. That is usually to stage the disease, whether it has spread to any other parts or it is localized to the breast and the armpit glands. So if it is localized to the breast and armpit glands, then the treatment is different. If it has spread, then the treatment is different. So usually depending on the size of the tumor or if there are axillary glands in the armpit, we may need to do a certain test like chest radiography, X-ray of the chest, ultrasonography of the abdomen, and if it is a larger tumor or there are many glands in the armpit, then we may need to do a bone scan or CT scans of the chest and abdomen. Now, which tests are to be done in which patient, that varies according to the clinical scenario and will be decided by the doctor. Now, suppose the disease is, we have done all the tests, the disease has not spread anywhere. Then usually the treatment done is surgery. Either the breast is removed entirely along with the glands in the armpit, or only the tumor is removed, keeping the breast in place along with removal of the armpit glands. Now, which surgery can be done, that depends on the location of the tumor and the size of the tumor. If it is a small tumor, then usually the breast can be preserved and we can still do the surgery. If it's a larger tumor, then we can sometimes give chemotherapy to shrink the tumor and then do the surgery, which can help to preserve the breast. And after surgery, what are the treatment options? Because only surgery is always not enough. There is a risk of the disease coming back. So we have to think of other treatments like chemotherapy, hormone therapy tablets, or radiotherapy. Now again, which treatment is to be given to which patient depends on the final biopsy report, the age of the patient, the type of the tumor, many things are involved. So all these things, the doctor will see the final histopathology, that is the biopsy report, and then discuss with the patient the options and which option is best for the patient. Now, the next question comes is chemotherapy. Suppose a patient has been advised chemotherapy after surgery for breast cancer, then the patient gets very much worried that chemotherapy can cause a lot of side effects and it can be difficult to cope with. So that is the next question which comes commonly to us from the patient. And the answer is not a simple answer, because yes, chemotherapy can cause side effects, but not all chemotherapy cause the same sort of side effects. There are some newer drugs which cause less side effects. Also we have got many medicines nowadays which can help reduce the side effects. So what are the common side effects? There can be vomiting or nausea. So we have many medicines which can control the vomiting nowadays. There can be ulcers or sores in the mouth. There can be loss of hair, which regrowths, there is regrowth of hair after stopping of chemotherapy, so it will come back. There can be constipation or loose motions, loose stools, intestinal symptoms, reduced appetite and weakness. So all of this you have to be in touch with the doctor from time to time, so that all these side effects can be managed appropriately. And if the patient is unfit and the patient is very elderly, then usually chemotherapy is not given. Young and fit patients can tolerate chemotherapy quite well. Another side effect of chemotherapy is lowering of the blood counts. The hemoglobin may fall, the white cell may fall, and platelets may fall, which we need to monitor before each chemotherapy cycle and sometimes also in between the cycles. And we have appropriate medicines by which we can increase the hemoglobin or the red cells or the white cells, so that no serious side effects occur. But all of this require very good monitoring throughout the chemotherapy cycle, and in case of any emergency, you can always contact the doctor and find out which medicine may help to reduce that particular side effect. Commonly after each chemotherapy, specific instructions regarding diet, that is well cooked food is to be taken only, the outside junk foods are usually not allowed. Also the care of the mouth by regular mouth washes, care of the bowels, all these things will be explained, and in case of the common emergencies, emergency medicines will be prescribed along with the discharge summary. If anything unusual happens, you should come to the doctor. Now suppose a patient has finished all treatment, but then also the treatment is not finished. Then comes the next step, that is follow-up, which is very important, because number one, the disease may come back, for which we need to keep our eyes and ears open, and if there is anything, we should catch that early. Another thing is side effects of treatment. We need to make sure that there are no side effects of previous treatment and the effects are gradually going off and the patient is coming to the normal life. Many patients also have psychosocial problems because of the disease, the treatment of the disease, the effect on the family. So many patients will require psychological support, which is also provided at this time. And some patients will require hormone therapy, which is it is only for the hormone sensitive type of breast tumors, which has to be taken for a period of 5 to 10 years on a daily basis as prescribed by your doctor. Those things are also monitored during the follow-up visits. Usually no routine tests are done, only yearly scans of the breast by ultrasonography or mammography is done, and if there is any other problem, then other tests are done accordingly. So the bottom line is fear is not the answer to breast cancer. Whenever you suspect anything, you should come to the attention of your doctor, and even if something is detected, any cancer is detected, if treated appropriately, then the patient can be cured of the disease. Thank you.